The Early Development Index, or what we also call EDI, is a really powerful population-level tool that helps us understand and gauge school readiness for young children, namely children that are in kindergarten.
And the best way to describe it is it's a population-based evaluation tool that looks comprehensively at a child's readiness for kindergarten across 5 developmental domains. Things like social competency, emotional maturity, language development, general skills and knowledge, physical health and well-being. It's really important that we look at a child's development from a whole child approach.
It allows us not just to see how students in one school or in the other school are doing, but really how students in general are doing within a certain geographical area, whether that's at the neighborhood level, the district level, or in this case, in Orange County, the county-wide level. I've worked in many different projects that have to do with helping communities improve conditions, and it is rare that we have data available to us. So as community-based organizations and as groups that were interested in really targeting and improving early learning outcomes, this was a treasure trove of information for us.
A lot of times we as organizations come in with some preconceived notions of, well, that school is doing well, or that school is not doing so well, or this neighborhood, you know, the different neighborhoods have different status, that they have a different level of achievement in academics or a different status in financial stability. And it just really opened our eyes.
We were in for a lot of surprises when those maps were provided for us, where we looked at how our kids doing in basic literacy, numeracy. For each of those measures, we had a different map available for us. We put those maps on the wall. We had a team of us walk around, look at the maps, and ask ourselves which neighborhoods are doing well in terms of literacy and which ones weren't. The EDI was the beginning point of this process with data that taught us about our own community, or at least the facts about our own community around early learning. But engaging the data created a community of learners amongst the organizations. I think one of the good things about EDI and also the support that the Commission gave to the collaborative is that it gave us time digging into the data. And as we dug into the data, we also began to develop a common language, right? So then we were able to know not only where we were at in terms of our baseline. In 2016, now we know where we're at. And it allowed us to come up with shared goals.
So what the Early Developmental Index allows us to do as a community is pull together and understand this data in a way that then can translate to additional resources or a better alignment of resources within the community. One of the things that it also allows us to do is take a more systems-wide approach to early childhood rather than relying solely on an educational system or a healthcare system. It allows the community to come together and look at the whole child and what additional resources can be done that might affect across multiple domains.
There are certain areas where the EDI was showing that children were lower in socio-emotional, and they were low in fine motor. And so what we did is we looked at what type of concerns and what type of referrals are we then providing to the families that are calling, and then they very well align with a lot of the data that EDI was showing. So if a parent was looking for, a social skills class, or they were looking for activities to help promote early learning and kinder readiness, we would want to obviously link them to a class like a Mommy and Me or a learning link within their community to help foster those particular skills and help further the development in that particular area.
We have our instructors and our teachers utilize that data to lesson plan. So the data will measure where children are in different domains. One, for example, is social emotional. So if we see that a child is lacking in that area, we can then provide more activities specifically targeted towards social emotional development, thereby working collectively to improve those test scores. We can target and see what specifically we're doing and if we can do it better.
And when we see the community is able to come together and talk in the same language, develop their own targets, you really see a much more active and engaged, empowered community that believe that there's a path forward to changing the ultimate educational success of their youngest population.